About the hormonal changes that occur during pregnancy. I'm Dr. Padmaja Veeramachaneni and I'm available on Baby Chakra at PADV. In pregnancy is a unique condition in which entire life grows inside the mother's uterine cavity. So, in a baby, there are genes from the father, there are genes from the mother. Both together as a combination make up the embryonic and a fetal genome. That means the baby has its own genetic programming. Now, take for example, a simple thing that everyone understands, like blood transfusion. Blood transfusion means you're taking blood from someone and putting it in someone else. So randomly, you see, in marriages and all that, we're just marrying and the person and both of us together are having a baby, but we're not checking the HLA compatibility and things like that. So when you're giving a blood transfusion, there are so many antigens, antibodies that are checked before you decide that this blood will be compatible and not cause a reaction in your blood transfusion. But in a baby, imagine an entire new person with an entire new organ system is growing inside us, and our body, where the immunity is programmed to reject anything that is not ours. That is the reason blood transfusions and all can cause reactions. You just can't transplant a liver or a heart or a lung or a brain or anything like that, because there will be an immune rejection. But a baby grows inside the mother's body without getting rejected, and only when the baby grows to 9 months and is fully grown, fully capable of leading an independent life, that the delivery happens. So this change and acceptance of a foreign person growing inside us is by by having the facilitator is these hormones. So the first change that happens is there is a rising beta Hcg. That means as soon as the baby is there in the uterus, it is sticking inside the uterus, it is growing and trying to get a grip in the mother's tummy. These finger-like trophoblastic tissue, that is the roots that are growing inside, these send a hormone called Hcg. So as soon as that is what we check and as a urine pregnancy test. So the first hormone change that happens in pregnancy is an increasing beta Hcg level. This Hcg goes to the mother, tells I'm there, and whatever are the hormones that happen during ovulation, the estrogen, progesterone, that cause the endometrium to grow, where this baby is continuing to sustain itself, it tells I'm here, I need help till I establish myself, to the mother's body, so that mother continues to send estrogen and progesterone, so that the baby continues to grow till a placenta is formed. And these hormones are what support this baby to grow inside till the organs are formed, till the placenta is formed, and the continuation of estrogen and progesterone happens in the placenta. So, estrogen and progesterone are the hormones that are necessary to make a uterus grow from a small size to a big size to fit in the baby till 9 months. So, the muscle should grow, the fibrous tissue should grow, the blood supply should improve, it should grow and supply the placenta. So, estrogen is necessary for that. And normally, the uterine muscles contract and they will push out anything that is inside it. So, progesterone is the hormone that keeps this whole thing relaxed so that it can stretch and continue to grow rather than contract and push. So, estrogen is necessary for growth. Progesterone is the hormone name progesterone itself came progestin. That means it is a hormone that continues the pregnancy. Gestin is life, pro is pro life. So this progesterone hormone continues. And along with that, the metabolism has to increase, because we have to look after our body, and we have to be able to metabolize to let that baby grow. So there are a lot of changes in the thyroid hormone. So if a person is having low thyroid levels, then that means her thyroid gland is not producing enough hormones for a smooth metabolism. So in pregnancy, when there is a lot of demand, what was not being produced previously will definitely not be able to cope up now. So we need to increase thyroid supplementation. And why is that necessary? The baby makes its own thyroid hormones only after the third month of pregnancy. Till then, it is totally dependent on the mother's thyroid hormone status. So if the mother who is hypothyroid, or we don't detect a thyroid problem and we don't give adequate supplementation, the brain cells which are learning to connect to one another, and that is how the brain is a very, very complex computer like thing, will have few connections. So the intelligence level is going to be lesser. So I talked about the HCG, we talked about estrogen, we talked about progesterone, and we talked about thyroid hormone. The other hormones that are there are called placental lactogen, somatostatin. So these are the hormones that increase the mother's blood supply. Normally, what happens? We eat some food, the food gets digested, our blood sugars rise, our body uses how much sugar it needs for the metabolism, and the rest of it will store as glycogen, so that when we need, that glycogen is metabolized and glucose comes. But the baby is constantly moving inside, so constantly it needs energy. So the baby may, now it is not like if you're not going to eat for 8 hours, our blood sugar levels fall down, and the baby is inside the uterus. In the blood sugar, it should continue to survive, means it's very difficult. So to prevent the mother's blood sugar levels from falling down when there is a period of fasting, the placental lactogen and the other hormones, all of them rise up the mother's blood sugar. So when a woman eats, because of all these hormones acting against insulin, which is the hormone that brings down the level of blood sugar, they all, it's a tug of war. Insulin tries to bring down the blood sugar, all other hormones try to bring it up, so that the balance between these maintains the blood sugar between a fasting of around 80 to after a meal around 140 to 160. And in this environment, the baby constantly takes the blood sugar and uses it for its energy purposes. But in some women, especially women who are of the higher age group, women who are overweight, women who have a strong diabetic gene, women who are having a twin pregnancy, hypothyroidism, treatment after infertility issues, where a lot of hormones are there, people who are not exercising well, who are having a high carbohydrate diet, in all of them, the problem is that the compensatory rise in insulin with these hormones does not happen, and the blood sugar levels start fluctuating too much, and they go beyond this 140 range, leading to a condition called diabetes in pregnancy or gestational diabetes. The problem with that will be that when the mother's blood sugars are high, they go across the placenta to the baby. So the baby will have a high blood sugar, and excess glucose is converted into fat. So the baby will be obese. Excess blood sugar is also used for protein synthesis, and the baby is big. So when there is a big baby, when there is a fat baby, delivery is going to be very difficult. And during vaginal delivery, if the shoulders are very broad or if the head is very big, there is a high chance that it will get stuck in the birth passage, and what we call is shoulder dystocia. That means the head will come out and the shoulders don't come out, and that is a very, very scary situation. So this is the last part. But before that itself, the baby's metabolic programming, the obesity genes, how much fat is there, how much muscle is there, how much the size of the different organs is going to be, is all decided by the nutritional status of the mother and the baby. And in gestational diabetes, all these are altered, leading to a lot of complications in the baby once the baby is born. So, and the genetic programming is set inside the uterus. So if we are born with a diabetic program, any change in our lifestyle, any slight increase in our food, a little lack of exercise, going a little overweight is going to make us diabetic. That means the health problems of what is usually occurring with old age at around 60, 70 years will happen in the 30s, and women and the next generation is going to live half their life as diabetics and hypertensives, and that is what we don't want. That is the reason in pregnancy, getting a gestational diabetes screen, that means 75-gram glucose 2 hours later, getting a blood sugar test, is one of the most important tests, and taking care of it in utero is very important, so that there will be a healthy baby and a healthy outcome and for these babies. So these are the most important hormonal changes. There are a lot of other changes. There is increased relaxin, there are increased activins, inhibins, all those that help change the muscle tone, the contour, and that is the reason there is increased backache. There is change in the vitamin D metabolism, and bony aches are more common. So we have a question coming: what is the role of hormones during pregnancy? The primary role of hormones in pregnancy is to help change the mother's metabolism, immune system, and her uterus and the blood flow, so that a baby can grow inside her. So all these changes hormones do. So the our respiratory rate increases a little, so that we take in more oxygen for ourselves and the baby. Our heart rate increases, the pumping capacity of the uterus increases. So all these are the hormone changes occurring in pregnancy. So we have another question: does hormone changes affect babies? So as I was telling you, if there is a poor placenta, there is very low estrogen, then or there is low progesterone, then there is an increased risk of abortion. If the thyroid hormone deficiency is there, baby's brains and intellectual capacity is compromised. If the insulin capacity is not there, pregnancy has diabetes, and diabetes will affect the babies. So at one extreme, if you have a bad placenta, you have a small baby who is born, who has a risk of prematurity, and at the other extreme, you have a big baby who will be a diabetic baby and an obese baby. So both extremes are not good. uh, Another question I have is: will hormones make me go into depression? um, it's not really the hormones that make us go into depression. Our inherent status, that means that our brain has chemicals which make us happy and which make us sad. So if we have an imbalance in them, the happiness hormones are decreased and the sadness hormones increase, we are in depression. So if we are prone to depression, if we have a family history of depression, then we also feel these changes before the menstrual period. So women who are prone to premenstrual very irritability, lots of depression, mood changes, crying episodes, inability to control our emotions, those labile things, these are the people who will go into depression, because pregnancy has an exaggerated amount of the normal hormones in our body. So we have another question from Parvinder: how do I control my emotions in pregnancy? So the most important thing is focus on the good. uh, don't read depressing news. Don't go through WhatsApp which give you social media changes. Don't watch war and violent movies. Cut down your electronic use. Do deep breathing relaxation exercises and focus your mind on positive things. Look forward, be alert about the changes in your body, feel how your baby moves. So make sure that you eat a balanced diet and a diet which has a lot of fruits and vegetables rather than spicy non-veg food all the time. So these all help you control your emotions, and make sure if there is no contraindication to exercise regularly, and that will make you feel good. We have a very good saying, move the baby. So if you move, your baby also moves with you and you feel active. You can see the response of the baby to that movement, and that is what gives you happiness. Have confidence in yourself, have confidence in your baby, have confidence that your doctor will do the best job for you, and that itself gives. If you believe in God, if you believe in chants, chanting Om is a very, very soothing thing, because that brings universal peace to everyone. So I think following simple measures like this does help you control your emotions. And one more thing is, lots of women I see, they tend to catastrophize events. That means if they feel a little pain, they think, oh God, something is wrong, I'm going to abort, I'm going to bleed, my baby is not going to be okay, I'm not going to be okay, what will happen if things go wrong? So that thought process, once it starts, everything starts going downhill. So if for small things we shouldn't be blowing them out of proportion. So that is what we call avoid catastrophizing. Every small thing that is a variation of normal does not mean a calamity. So when you go to your doctor, they will usually give you warning signs. In the first 3 months, these signs are not good. In the second 3 months, these signs are not good. Later on in pregnancy, these signs are not good. So only that if you feel severe, start worrying and contact your doctor, because they will reassure you if everything is going fine. One of the things I miss about joint families is that in joint families, there would be a huge number of older people who would have gone through, especially grandmothers. They would have had seen their children being born, they would have helped their siblings have children, they would have had their grandchildren. So they know what is normal, what is abnormal, and they are the ones to pick up abnormal signs and reassure you that things are going okay. Now, with nuclear families, there is hardly anyone to advise. And most of the time, when you Google, what you get in personal blogs are not really happy things. People will tend to tell you all things that can go wrong. And it is a very scary situation, because very few people share the good things about life. So try to focus on what is good, and then you will feel less stressed out. Okay, Naina, do we have any more questions in the question box? Um, so, change is inevitable in the body. And these hormone changes also lead to increased water retention. So your rings become tight, your face feels bloated, your eyes get puffed up sometimes. And because the weight is increasing, there is a little amount of anemia. Sitting for long makes you have swollen foot. So these are also part and parcel of changes in the body. The beautiful thing about pregnancy is it lasts only for 9 months, and every time something is different, you can only rest assured that it will all pass. So this too will go. That is what is there. So is it possible to reduce hormone changes? Should I visit a doctor or start yoga? We don't want to reduce hormone changes, because hormone changes are what is keeping your pregnancy going on. We want you to learn to accept the hormone changes and move ahead. Okay. And if you feel emotionally very fragile, you can talk to your doctor, they will suggest something. And in yoga also, not all yoga is okay, so you need to have a specific instructor, and you need to know what is okay in pregnancy, and don't push yourself too much. If something is hurting, if something is not feeling good, don't continue, because I don't think in pushing bodies to the extreme. Every person is different, so you need to have a personalized caretaker and a yoga teacher for you. uh, One more question is, till the end of delivery the hormone changes will continue? Yes, because hormones are the ones that are maintaining the pregnancy. So till delivery they're going to be there, and some of the hormones, after the delivery is over, after the placenta comes off, those hormones are going to go away from our body, and our body is going to take 6 weeks to recover. But few changes, because once a baby is born, mother is going to breastfeed, so there are going to be some different hormone changes. Increase in the prolactin is going to be there. So if people are prone to depression, postpartum is one place where the depression is going to be very severe. So this definitely needs talking to a doctor, if referral a psychiatrist, and being on medications, because you don't really have control on postpartum depression. So it is definitely needed to go to the doctor. And postpartum depression has an association with depression later on in life, and it recurs in pregnancy. One of the reasons why it happens is babies continuously cry, you feel inadequate whether I can take care of this new baby, you have a lack of sleep, you have lack of privacy, because people are coming, visiting, talking to you, waking up and all hours, you got to continuously breastfeed the baby. So all these is going to play havoc on your mental status. So as we are coming to the end of our session, my takeaway messages: start off your pregnancy on a positive note. Before you plan your pregnancy itself, if you have any preceding hormonal problems, especially problems with thyroid or polycystic ovaries, make sure that your medications are in time. Make sure that you lose body weight. Make sure that you have a regular exercise program and a fit body when you start pregnancy. Take your folic acid medication right from the beginning. uh, Hormone change like HCG causes a lot of nausea, vomiting in the initial phases. But remember that your body is adjusting to a baby inside, and that is the reason there are so many changes. Accept change as it comes. Consult your doctor if you're feeling very sick, because there are good medications to control that. And the human life has evolved over 50,000 years, so having a baby is a robust phenomena which will run smoothly most of the times, unless you have preceding health issues. So don't use medications off the counter. Consult your doctor and only then use medications. And usually 85% of pregnancies go through uneventfully. But make sure that you do not put on too much weight. 8 to 9 to 11 kgs weight gain is okay, nothing less, nothing more. If people are overweight, not gaining any weight with the baby growing well is also good enough. And in pregnancy, at least 3 times, get your screen for gestational diabetes, irrespective of the meal. 75-gram glucose, mix in a glass of water, drink it over 5 minutes. After 2 hours, get your blood sugar done. It should be less than 140 milligram. So if these precautions are followed, it is unlikely that there will be any major complication in pregnancy, and it will go smoothly. Having a positive attitude, doing a regular exercise program, having balanced meals also helps a lot. Make sure that you have a good calcium intake by making sure you have milk and curd in your dahi, whatever it is, yogurt, whichever form you like in your diet. Thank you very much.